More than 1 million heart attacks occur each year in the United States due to a blockage in one or more of the coronary arteries. And almost 500,000 people die annually from this condition. Angina pectoris affects approximately 4 million people in the United States today. The excruciating chest pain of angina leaves many patients incapacitated and often leads to a heart attack. Now there is a major advancement in the treatment of coronary artery disease. The CardiAssist counterpulsation system from CardioMedics, a state-of-the-art, non-invasive circulatory assist device that increases the amount of oxygen-enriched blood delivered to the heart. Bypass surgery can relieve angina, but costs over $40,000, entails significant risks, and sometimes fails. Balloon angioplasty is another angina procedure, but costs over $20,000 and fails in approximately 40% of the cases. Now there is an alternative, the CardiAssist counterpulsation system, which may enable many angina patients to avoid bypass surgery, balloon angioplasty, and perhaps even a heart attack. This is because repetitive use of the CardiAssist counterpulsation system increases blood flow to the heart, and it is thought that increased pressure in the coronary arteries can cause the release of angiogenic growth factors, in turn allowing new vessels to form around the blockages. In essence, a natural bypass. Completely computerized and state-of-the-art, the CardiAssist counterpulsation system sequentially inflates and deflates a series of cuffs wrapped around the patient's legs. Starting sequentially in 35 millisecond increments, the calf cuffs are inflated. This is followed by the inflation of the thigh cuffs. And finally, 35 milliseconds later, the optional buttocks cuff is inflated. Working together, the system cuffs ultimately augment diastolic pressure and reduce cardiac workload. And because the cuffs are deflated before the onset of systole, systolic unloading is improved as there is less resistance to pumping blood out of the heart. Inflation of the cuffs is synchronized with the patient's electrocardiogram, or ECG, and is timed to occur only during diastole, when the heart is momentarily at rest. The CardiAssist counterpulsation system is completely self-contained and easily portable. It is operated by simply touching the appropriate icon on the touchscreen display. Timing, duration of inflation, and the amount of pressure applied to the patient's legs with a maximum of 5.5 psi or 285 millimeters of mercury are all controllable and displayed on the control console. The patient's electrocardiogram is also displayed on the CardiAssist control panel. The wavy line on the ECG indicates the point of application and cessation of pressure being applied. Both ECG and pressure tracing can be frozen at any time for a closer inspection of detail. Arterial pressure is obtained from a finger plethysmograph and is also displayed on the CardiAssist control panel. The CardiAssist strip chart recorder can produce either a continuous record of the patient's ECG and arterial blood pressure, or can be set to automatically print a 5-second sample at the end of each minute of therapy. The patient's ECG and arterial blood pressure are stored automatically on the hard drive of the CardiAssist system computer. The data from the hard drive may be downloaded to a floppy disk at any time. The CardiAssist system automatically adjusts to changes in cardiac rhythm and will shut down if the patient's cardiac rate exceeds 120 beats or falls below 45 beats per minute. The system also automatically compensates for premature ventricular contractions and will not permit pressure to be applied during systole. The CardiAssist counterpulsation system is ergonomically designed and easily transportable, so that it can be quickly and easily applied to a patient without a surgical team or surgical backup, enabling a normally trained medical staff to stabilize an emergency cardiac patient. Joe Frausto is one patient who now enjoys a normal lifestyle. 10 years ago, Joe suffered a heart attack. After triple bypass surgery and subsequent balloon angioplasty, Joe's angina, with severely debilitating chest pain, returned, leaving him incapacitated. Joe and his cardiac team at St. Joseph's Hospital in Orange, California, decided on treatment with the CardiAssist counterpulsation system. After 10 hours of therapy, Joe was asymptomatic. After 20 hours, his energy level had dramatically improved. And now, 6 months after a total of 35 hours of therapy, Joe is pain-free and enjoys a highly improved quality of life. The established regimen for stable or chronic angina patients is 35 hours of treatment, typically 1 hour per day, 5 days per week for a period of 7 weeks. Treatments of 2 hours per day, 5 days a week can shorten the therapy time to 3.5 weeks. Counterpulsation has produced the following positive effects in patients with coronary artery disease. A reversal of ischemic defects, as shown by thallium scans in stable chronic angina patients. Improved patient treadmill exercise times. A reduction in the amount of anti-anginal medications. General improvement in the quality of life. Additionally, in a randomized controlled clinical trial on a previous CardiAssist device, there was a reduction in mortality in Class II acute myocardial infarction, or heart attacks, to 6.5%, compared to 14.7% for the control patients, as well as a 35% survival rate in the treatment of cardiogenic shock as compared to a typical survival rate of less than 10%. The CardiAssist counterpulsation system from Cardiomedics provides portable, non-invasive circulatory assistance therapy for persons with coronary artery disease. It has been cleared for marketing by the FDA for the treatment of acute myocardial infarction or heart attacks, cardiogenic shock, and angina pectoris. And the first-generation CardiAssist device is the only counterpulsation system that has been shown in U.S. clinical studies to reduce mortality due to both heart attacks and cardiogenic shock. All in all, the CardiAssist counterpulsation system is the device of choice in the treatment of coronary artery disease. The CardiAssist counterpulsation system from Cardiomedics. Tomorrow's non-invasive and cost-effective solution to coronary artery disease, available today.